Hi, this is Dr. Susan Blakeman. I am just giving you a quick tutorial to orient you to the second half of the semester for Nursing 451 individual psychotherapies across the lifespan. I've had the chance to meet with some of you, but I just want to make sure that all is clear. We are at the 7-week mark, and that marks the wrapping up of the adult content. I realize that you still have some work to do in terms of preparing for your midterm and submitting your case write-up, but you will be building on that information to carry you through the child and adolescent content, which starts now. I want to just make sure that you are aware of the deliverables of the second half of the semester. And so when you're on Blackboard, you can just go to the syllabus, and I encourage all students to go back and check the syllabus regarding what is up and coming. So for this half of the semester, it will feel a little bit different. This portion of the course was really designed to be an online course, and it has a little bit more flexibility perhaps than the first half of the semester. That is really good news for you as you are trying to wrap up some of your other pieces and start thinking about moving ahead. So for this half of the semester, the most important things that you're paying attention to is, one, how you get at the course content, and I will show you that momentarily, and what the expectations are. I want to bring you to the guidelines for the presentation that you were doing based on a case application. So you were assigned cases randomly. I will show you those momentarily, but I just want to make sure that you know what is expected. What we will be doing this semester, and in part due to student feedback about not being so fond of discussion boards. We'll have to figure that out. But you will be doing at the end of the semester a 15 to 20 minute presentation, leaving some time for question and answers that are about the case that you were assigned. And in that, what you want to be doing is a sort of a brief summary of the clinical data. You want to be including you'll be given something of the history, and you're going to want to be looking at the diagnostic formulation and a diagnostic impressions list. Then you want to be thinking about the therapy model that is related to that case and identify the theoretical framework that underlines the therapy. You're going to want to cite a theory to be able to do that. Okay, so all of our therapies have a theoretical basis. The theoretical basis is clear from what you've learned so far and what you will be reading about each of these therapies as we go further. Okay, and then you're going to want to use that therapy to explain why this particular therapy model is congruent, the application is congruent to this particular patient's problems. And so what is leading up to the symptoms that you are seeing in the case study? What is continuing those symptoms? And you're also going to want to consider what are the strengths of the client too. Okay, so drawback from 450 when we thought about the biopsychosocial model, when we thought about the predisposing, the precipitating, perpetuating, and the protective factors. Okay, kind of pull those things in from your previous coursework. Then you're going to want to think about, what are the target symptoms? Okay, what are the mechanisms? What are we using in order to target change for this patient and or family because of this particular therapy that we've chosen? And then you're going to talk about the rationale. So what do we know about why this therapy is effective? And pulling from the literature again, it does not have to be an exact match to your case and the therapy, but you're going to want to be thinking of, okay, this has been used in this age group before. This has been used for these symptoms before. This has been used uh, with families in this way before. And so that is where you're going to want to pull the evidence in, and you're going to want to talk about the strengths and limitations. So the strengths are going to be, in terms of was it effective and why you think it was effective? Did it match your case? Was it designed well? And the limitations are going to be around the things that didn't work up. It would only work in this population and not another. It would, they didn't find these particular things, or the controls of research were probably too rigid to make sure that we would know it would be applicable across other populations. So think about those. You also want to be thinking about the cultural considerations for this particular case, and some of these clues will be given to you in your scenario, and some of them may not be. So think broadly about culture. Think about not only things that are pertinent to race and ethnicity and religion, but also things about what is the family dynamic, what is the age, what are acculturation issues, what about poverty, what about education, things like that. You can really think kind of broadly around culture and anything that would make you be particularly sensitive in terms of approaching a child and family with a therapeutic intervention. Ethics and public policy are, of course, going to be important. So what are the potential ethical dilemmas? Why would this be a just thing, perhaps, to use with this particular case? What would be the limitations, perhaps? And what about the policy that would consider that? Again, we are threading through your entire curriculum the things that are going to be important on your comprehensive examination. And so that is theory and evidence and ethics and public policy, and you have good practice right here and now using them. Fancy slides are great if they are legible and concise and they get the message done. Spend more time, of course, on the content than you would on the slides. So you're really going to want to be as concise as possible, but covering all of the salient points. This is your opportunity to present a case, to be an expert on a particular case in a therapy, and you are responsible in many ways of helping your fellow colleagues learn about this particular therapeutic modality. So take that responsibility seriously, because you're really helping each other out. And we don't have a chance to talk about these things until the end of the semester. So we really want to do that in a way that's helpful. And thus we're going to ask that everybody be a bit prepared to come in to that conversation, not only with your own things, but with questions as you go through the learning modules. What questions do you want answered by your colleague expert? Okay, so that's really the main points of this particular deliverable for this half of the semester. And you can ask me questions, of course. The other things that you will be doing is doing quizzes every week, at least one quiz per week, and those will not be added directly to your course grade, but more to your participation grade. So if you are completing those and getting at least an 80% on them, then you can get full credit for participation, but you can take them as many times as you want, so I really encourage you to do that wisely. And then you'll be having a final multiple choice online exam at the end of the semester, and that is, of course, also in your syllabus. Okay, and again, look at your course requirements here. Okay, so let's just go for a quick second to the learning modules. And we're going to look at 7. This is the transition to the child and adolescent content. But I also want to show you that this is where the assignments are. I did randomly assign that, so you will find your name, and they're not in any particular order because that's how the random generator picked them out. Your name and then your case name. And if you click on here, you will see the cases with the names of them and mostly identified the therapy that needs to be used with that particular case. Okay. All right, back to Module 7. Okay, so you will see this is what looks very familiar from the first half of the semester, and this is where things are going to be changing a little bit in terms of what it looks like for the online, the more online design content. And so if you go in here, you'll have a little introduction, and then in every module with child and lesson content, you will have some sort of a folder like this that you're going to want to click on. You will notice that you've already talked about interpersonal therapy in the first half of the course. We're revisiting it with a child and adolescent focus here, as well as applying motivational interviewing and dialectical behavior therapy. So there's a separate folder for each of these things. I'm just going to click on the DBT one here. And so you'll see in every module for this half of the semester, an overview, some objectives, the learning activities, and the test yourself quiz. So please do take this quiz and take it as many times as you want to make sure that you have mastery of the content. Note that I will not be looking for I will be able to see how you're doing on your quiz and if you're taking the quizzes, but I will not be interacting with you around the content like Mary did. So you're not submitting questions to me and getting feedback in that same way. So if you are having difficulties or questions, I really want you to let me know that so we can help you sooner versus later. And so what you will see is the module learning activities. So here is a PowerPoint for you to open. The required reading is on the syllabus. It's on the chart that you've been using already. Please see that. If anything else is listed, it should be consistent with that. And anything additional, really, in terms of readings, these are sort of supplemental, okay? So you'll see required readings and required presentations. So this is media site. I'm going to click on that just to show you. You'll get this page and then you can click on that. Oh, this is giving you a thing that you can't be played back. So that is interesting. I haven't gotten that before. I had heard that other students had gotten that. So this might be just an issue with my particular player at this point. If you get that, please contact the ZSONBB help in order to get assistance with that. Like I said, I have not had that problem before. I also did hear that that media site sometimes has its own issues. So sometimes if you can't get on right away, pick another browser, because that's another way to do it, and or try it another time. Okay, but the media site is really just designed to go with the PowerPoint. It's the same thing. You'll see Dr. DeSocio talking to you, and as we are moving into a transition around this online curriculum, I retain these because students had found them helpful before. We will be redoing them, but for right now, this is your best bet. So you can just see how I'm getting back to all of this. Okay, so sorry I can't show you that. Again, you will get the materials you want from here, but this is just another way of interacting with the information. Okay, and then it says to bring you back to the test yourself quiz. So I think that is pretty self-explanatory. I think that most of you have had a lot of experience with dealing with the Blackboard format. It's very consistent with the other courses you have taken. Same for motivational interviewing. If you have any questions at all, again, these should be on your syllabus already, then you just let me know. Okay, any suggestions or recommendations, that is fine too. And don't forget to check your announcements. Okay, I do post announcements, if not weekly, on a frequent basis to make sure that everything is that we are all in sync together. So please do check those, and this is where you'll find that email and Joe's contact information if indeed you have technical assistance needs as we go forward. Okay, thanks so much. Good luck. Keep on going. My last parting comment is because you're not being asked to turn something in pretty much every week, it's up to you to stay on top of the content. You can do it at any time. You can go back and forth. I will be opening the rest of the learning modules in the Child Lesson content for you because they have been hidden. That's so you can start working on your presentation ahead of time. It doesn't really matter what order you do the modules in, as long as you're keeping pace with the work and it's not all left to the end. Believe me, you don't want that. Okay, good luck. Hope to hear from you soon. Take care. Bye-bye.